like I was saying before, there are what we call what markers, understand? Those markers we call the liver function what markers, understand? They are those they are what they are parameters that you see in the liver function what your liver function result, test result basically. And I usually use a what mnemonics called what BDAP. This BDAP simply means the B, the first parameter is what bilirubin, bilirubin, and the E are what enzymes involved basically, enzymes, and the D they are what drugs, and the A is what albumins, and then the P is what prothrombin time. So all these parameters basically they represent the five what types of liver function what tests. You understand? So as we all know that since the liver is directly involved in the degradation or catabolism of what heme, and then when heme undergo what catabolic pathways, it gives rise to what bilirubin. So if the liver is affected, it means what the breakdown of heme into bilirubin will also be affected. So in this case, what you are going to experience, what you are going to see in the result of your liver function test is what an increase in the level of what serum bilirubin. Understand? Which is called what hyperbilirubinemia, right? Simply what bilirubin increase, bilirubin in the blood, emia, blood, right? Hyper means high, bilirubin means of course bilirubin, and then emia means what blood. So increase bilirubin in the blood. So coming to enzymes, what do you see in enzymes? You know that there are basically what certain enzymes which are what exclusively synthesized or are found in the liver. You understand what I'm saying? Okay, those enzymes they are what we have what the two important transaminase which are what alanine transaminase. We have also an aspartate transaminase, and also you have your GGT, right? GGT, that's gamma glutamyl transpeptidases. So what do you see? What actually do you see when the liver is damaged in relation to these enzymes? What you see is that you see an increased concentration of these enzymes in the blood. You understand? Their level in the blood will increase. There will be increase in what aspartate transaminase, which is usually abbreviated as what ALT, right? Your ALTs, your ASTs, and your GGTs. They will all go up. They will fly up. You understand? They will flame up. All right. Talking about what drugs. What do you see in case of the drugs? Understand? So basically, if the liver is affected, excuse me. If in the case of what the enzymes, basically the liver will spit them out as a result of damage. Understand? Okay, now in the case of the drugs, what you see is that there will be increase, what we call increase in the half-life, increase in the half-life of the drugs involved, of the drug. Understand? That means if the metabolism or the total breakdown of the drugs by the liver is supposed to take basically like normally, if it's supposed to take like 2 minutes basically, there will be increases like something like 4 or even 6 minutes. This will give you a hint that yes, man, that my liver is something is wrong with that. Now albumin. As we all know that the liver is the site of what? Albumin synthesis, you understand? So what do you see if the liver is affected? There will be decrease, of course. There will be what? Decrease in what? Serum albumin. You understand? And when there is decrease in serum albumin, there will be what? Decrease in what? osmotic pressure, you know. And when there is decrease in osmotic pressure, what do you see? There will be decrease. Oh my God, there will be decrease in what? No, sorry, there will be increase. Yeah, of course. If there is decrease in osmotic pressure, of course there will be decrease in what? Blood pressure, BP, right? And if there is decrease in blood pressure, what usually happens to the kidney? You understand? What the kidney does is that it now activate what we call alternative mechanism in order to compensate this decrease in blood pressure, because this decrease in blood pressure is not good for your body. You understand? It's not good for the body because it will lead to what delayed tissue perfusion. You know what I'm saying? All right. Now, what does the kidney do? The kidney usually what activate what we call the renin-angiotensin-aldosterone system. Understand? This is another what lecture on its own basically. But what will happen as a result of the activation of all this system, whereby the renin usually activate what angiotensinogen gets converted to what angiotensin 1. Angiotensin 1 goes to the lungs and it gets converted to what angiotensin 2, but what we call angiotensin converting what enzymes, understand? And then angiotensin 2 now what comes back to the what? It comes to the kidney, you understand? It acts on what? On the vessels, on the smooth muscles of the what? Of the vessels of the kidney, and it causes what? Vasoconstriction, understand? When it causes vasoconstriction, there will be what? And the vasoconstriction will now lead to an increase in the whole what? Systemic what? Blood pressure, BP, right? Which is not good for the body, you know? And also, basically, it doesn't stop there. The angiotensin 2, which is produced in the lungs, basically comes back and also acts in the what? So in the what? Adrenal cortex, you understand? To produce aldosterone, which will now lead to increase in what? Water retention by what? Elimination of what? Potassium ion and what? Hydrogen ions, retaining what? Sodium, basically, you know? So, decrease in albumin can lead to so many complications in the body. So you wouldn't like that in your patient, I guess so. All right. The next one is what? Prothrombin time, PT time, right? Not physical training though. It's prothrombin time, you know. All right. If the liver is affected, there will be an increase in what? PT time, right? Why? Understand? It will happen because what? There will be decrease in what? In the production. There will be decrease in the production of what? Coagulating, clotting factors. Clotting what? Clotting factors, right? Yeah. Therefore, this will now lead to what? Coagulopathy. Coagulopathy. Yeah, I know you know that. Alright, basically, let's go into the bilirubin. Now, let's go deeply into the bilirubin. That's the bread and butter right now. Alright, fellas, for more on liver function tests, just watch the